It is 9 p.m. You're getting ready for bed. You look at your pill box. You pick up that little cholesterol pill and you ask yourself a very simple question. Do I really still need to take this? If you're over 60, 70, or 80 and you feel completely fine, it's natural to wonder if you are taking too many medications. And for years, the medical rule was simple. If your cholesterol number is high, you take the pill. End of story. But as a geriatrician, I'm here to tell you that as we get older, medicine is rarely an all or nothing game. Whether you need a cholesterol medicine, a statin, isn't just about a rate number on a lab report. It's about your biological age, your personal health timeline, and something called time to benefit. Let's figure out where we stand together. First, let's divide everyone watching into two simple groups. Let's see if you are in group 1. I want you to answer yes or no to these questions. Have you ever had a heart attack? Have you ever had a stroke or a mini stroke? Have you ever had a heart stent or bypass surgery? Or a scan showing plaque blockages in your neck or your legs? If you answered yes to any of those, you are in the existing roadblock group. Your blood vessels have already shown a real physical tendency to form blockages. And for you, this cholesterol medicine is not just a routine preventative pill, it is an essential structural armor to stop a second, much harder blow. So in general, if you're in this group, the answer is yes, you should stay on your statin, whether you are 65 or 85. But here is the special geriatric exception. To get the life-saving benefit of this pill, medical evidence shows we need a runway of about 2 to 5 years. If you are an active, independent, and enjoying daily life, protecting that runway is vital. But if you or a spouse you are caring for is navigating severe physical frailty, advanced memory loss, or serious life-limiting illness, our goal as doctors change. In those sensitive moments, our focus is comfort. We want to reduce daily pills, and stopping the cholesterol medication is often the brave and medically correct decision. Now, what if you are in group 2? If you never had a heart attack, you never had a stroke, and you feel great, but your doctor says your bad cholesterol or your LDL is high, do you still need to start a new pill in your 70s or 80s? To answer this, doctors don't just look at cholesterol in isolation. We use a clinical calculator to figure out your 10-year heart attack or stroke risk score. It combines factors like your age, blood pressure, and cholesterol to estimate your exact percentage of having heart attack or stroke over the next decade. We use that specific percentage to make two decisions. First, whether you need to start a medication, and second, what target number we should aim for on your blood tests. Look at the score as a context to have a discussion with your doctor on prevention. If your score puts you in a gray area and you're hesitant to start a cholesterol pill, we don't have to guess. We can use a clinical tiebreaker. We can do a simple, painless ultrasound of the carotid arteries in your neck or quick calcium scan of your heart. If those blood vessels are completely clean, smooth, and elastic, we might safely hold off on the pill and just focus on your diet and exercise. But if we see evidence of significant plaque forming from these scans, then you and I both know exactly why we are protecting you with the medication. If you or your doctor do decide that you need the medication, I want to share a geriatric secret that will save you a lot of anxiety and frustration. You do not have to go to war over a single lab number. Many of my older patients quit their statins completely because they hate taking high doses, trying to push their cholesterol down to rock bottom. Here's what most people don't know. Statins do two completely different jobs. Yes, they lower cholesterol in the blood, but they also act as a powerful anti-inflammatory glue. When plaque sits in an artery, the real danger is that it breaks open and causes a sudden blood clot. A statin cools down the irritation inside the blood vessels and literally glues that plaque down so that it cannot rupture. If you are sensitive to medications, or you get muscle aches from high doses, don't just throw the bottle away. Talk to your doctor about taking a lower, comfortable dose. Why? Because even on a lower dose that doesn't hit rock bottom on the lab sheets, you're still getting that vital, life-saving glue to stabilize your arteries. Deciding to take a medication after 60 shouldn't be an ultimatum from a guideline or a formula. It is a shared decision between you and your doctor, one that respects your body, your daily comfort, and your personal timeline. Now, I know what you're thinking next. Dr. Lim, what if I already get muscle aches? What about my liver enzymes? And what about the warning that statins cause memory loss? That is such a vital topic, and we are going to separate the real side effects from the myths and break down the exact dietary swaps in my very next video. Have an honest talk with your doctor at your next appointment, and I will see you in the next one. Bye.